So that's going toward ulna. It allows for extension. Okay, so it makes sense when I'll do it in the juice. So this is the only one. It's because it's a spool shape. Everything else follow Coulter-Burns rule. Okay, so I have it on the board for you. To increase flexion and extension, radial glide or gap. So the name radial and lateral is named after the direction you're going in. So if you want to do a radial glide, which side are you going to be going on? On the opposite side. So it's going to be on the medial side. Okay? Because you're going to be gliding it to the thumb.
Okay.
So the name of the glide is named in the direction it's going in. So a radial glide is going to be on the ulnar side, the medial side. Does that make sense?
Right.
Okay. So an ulnar glide would be coming from the radius to the ulna. So that's how you have to remember the glides and gaps. They're named after the direction it's going in, not where the direction where it's starting. Okay, I'll show you here. So if I want to do a radial gap or glide, I'm going to be on the ulnar side, going toward the radius. Does that make sense? If I want to do an ulnar glide, I'm going to be going to the direction of the ulna. Okay, it's not named after where you start. It's named in direction you're going. Is that cool? Okay. Synovial hinge, uniaxial, concave on convex, doesn't follow that rule, the only one. Did I just go one more down? Sorry. Oh, the other direction, sorry. Just go back to that humeral ulnar. Okay, good. Oh, let's look at closed pack. So closed pack position for the humeral ulnar, so that's this joint here on the medial side, okay, is full extension in supination. That's where this joint maximally in contact with each other. Full supination, full extension. Okay, closed back. Resting position, here's 90, 70 degrees. Okay, so here's 90, 45, 55, 65, 70. Okay, so let's do that here. 90 degrees, okay, 45, 55, 65, 70. So it's an approximation. Neutral is this is 0 degrees supination pronation. So it's 10 degrees supination. So here's 90, full supination, 45, 35, 25, 10. 0, 10. Okay, so it's resting position. This is a really good position when people come in for tennis elbow. To put them in, you can put a pillow here. Where's that pillow?
It's definitely that position
Yeah.
you hold it in. If
This
you
doesn't-
hurt your elbow.
Right?
It's definitely that position you hold it in. You hurt your elbow.
Yes.
When you
Yeah.
raise the side.
Absolutely. Yeah, when they come in, when there's synovial fusion, this is the position that they're comfortable in. So this will be to your advantage if somebody comes in the acute stage. Acute stage. Yeah. Okay. Capsule pattern, flexion is lost first and extension. The reason flexion is lost first is because there's more flexion than extension. Okay. The joint capsule is normally laxed in the elbow joint, the entire. Hey, let's go all the way to the picture because we're going to do humeral ulnar. We're doing great for time. All the way to the distraction. One more. There we go. We're going to do that humeral ulnar general. Oh, that one. There we go. Humeral ulnar general distraction. We're going to take them to 0, 90, 70. Okay? I'm going to push down. Okay? And I'm going to also do a little bit of traction too. So push down. How you doing there?
It's good.
Feels nice?
Yeah, really.
So I'm pushing. I'm scooping actually. Go like this. Good. I'll do the other side so you can see. So find find that 70 degrees. Here's 0 degrees of extension. Here's 90. Take it there. Okay, I'm gonna scoop this way and stabilize. Okay. This is just a distraction, humeral distraction. Look at me, okay? Those pictures are poor pictures because they're one-dimensional.
Why do you do these ones?
Just stabilizing. Just
Okay.
holding. Yeah. That picture is one-dimensional. Look at me. You okay? So what you're doing is just a general distraction for the humeral ulnar joint. You're just putting in 70 degrees of flexion, and you're pushing. It's going. It looks like a J stroke. Okay, so you're pushing down to the table, and you're scooping. Feels nice, right? Feels really good, right? So again. I'm pushing down and up, down and up. Okay, I'll do it again. Find 90, 70. Okay, stabilize. Pushing down to the table and scooping. J stroke. Feels nice, right? Humeral distraction. Let's do the next one. Okay, lateral gap. Lateral gap. So humeral lateral gap. So it's using the word lateral for radial.
Right.
Okay, and the gapping is going to be at the joint line. Okay. So where is my hand placement going to be for lateral gap? It's going to be medial. It's going to be medial. It's going to be opposite. Place my hands here. Okay. Right here. Stabilize here. Right at the joint line. And I know closed pack is full extension. So I'm just going to bend the elbow a bit. Okay. I don't have to bend it to 70. This is all loose. This is maximal loose pack position. This is also loose pack. This is loose pack. This is loose pack. Here's closed pack. Just bend the elbow a little bit. Okay. I'm gonna watch his hands because I know it's close to me. Okay. Okay, and at the joint line, I'm gonna do a radial gap. Yeah, just a gap. Yeah. So I'm pushing toward the radius, also known as a lateral gap. Okay? I'll do a medial gap. Okay. So these pictures are really tricky. For the life of me, I couldn't figure out why, because he's using two different hands. He's using left and right.
Oh,
Okay.
like the body he's switching
Yeah,
between.
he switches. Yeah, he's switching.
I see.
So you have to really look where the thumb is.
Right, like
and he's
which way
also
the
using
palm.
a different patient. Okay, so different skin tone, different arm shape.
Yeah, those
So it's a bit tricky.
arrows
So
are
you
redirection.
really need to look at the name. So we know with a medial gap, you're gonna start where? Yeah, you're gonna start on this opposite. Okay, and I'm gonna have Adrian in loose pack, stabilize it in distal, and I'm gonna push. Okay, this is also called medial gap or ulnar gap. Okay.
So there's pressure downwards and
No, so it goes like this.
just lateral
It's,
and
the pressure is,
completely side
yeah,
to side.
yeah.
Okay.
so how it looks on the thing here. Okay. So when I do this, goes like this, it allows for flexion. See that? It opens up this little space here. See that? That space opens up on the spool. Okay, so it helps with flexion. And when I do this way, it allows for extension. All right. Let me think what else. Okay, so let me do this real quick. Gaps, GAP, is at the joint line. Glide is lower. Okay, so here's the gap again. And I'm gonna tell you something. You want me to blow your mind again? You know that song? Let me blow your mind. I played it for you last term. Yeah?
Yes.
So when I go like this, what's that gap?
Medial gap.
Yeah. Or what else?
Ulnar.
It tests the ulnar collateral ligament too.
Ulnar collateral.
Is that cool? Okay, what you're looking for is like excessive movement. Joint mice. We were talking about that earlier. So click, click, click.
Nice.
Okay. What direction am I going in? Lateral gap. Or what ligament am I testing? Yeah. There you go. Is that beautiful? Did I just blow your mind? Yeah. Aren't you glad you learned those ligaments in one?
I think I'm mildly confused. And
What'd you say?
I think I'm a little bit confused.
That's okay. So the gaps are named after the direction you're going in.
Mm-hmm.
So that's the tricky part.
So radial gap.
Radial
is
gap. Yeah. So
towards
here's the
thumb.
radius.
Yeah.
Thumb. So
Yeah.
we're gonna be starting on the ulna.
Okay.
It's
Pushing
named-
towards the radius,
Yeah.
and then the other way for ulnar. Yeah.
Yeah. So ulnar
Got it.
gap. So I'm going toward the.
Ulnar.
Yeah. Remember the humeral radial is only here. Right. We're not thinking about the humeral radial.
I think because it's a hinge, I'm
Yeah.
just like confused
sure.
about lateral movements within like a
Yeah.
hinge that just does flexion extension.
So, in 100 arthro, you learn that the humeral ulnar only allows flexion and extension,
Yeah.
when in fact that is not true.
Okay.
Okay. Surprise!
Now I might.
Surprise! The reason it's not true is because in 100 we like to introduce foundations,
Right.
black and white. Now I'm going to introduce you to the truth.
Wow.
Forget everything.
In real life, you hating me now?
Pull the cloth off.
In
our
real
eyes.
life, when you do flexion and extension, the elbow has accessory movements that pivot, allowing for all those movements in the elbow.
Right.
So when you go toward the radius, it allows for flexion. It pivots. So it rotates a bit. Right. The movement is 5 degrees.
Very small.
That's why it's not counted in 100 arthro. Okay? Because the movement is so small. Surprise. Okay, so the movement is 5 degrees. Very little. But that little bit allows for flexion and extension and pronation, supination as a whole. Okay?
Mm-hmm.
Surprise! I told you I'd blow your mind.
Yeah. Thoroughly.
Okay?
Was it hard to keep the truth from
It
us?
was. It was very hard. I had to like shut my mouth a bit because, hard to explain that a hinge joint does a bit of pivot joint in level 1.
So
Mm.
we've just done lateral and like medial.
You just did the gap. So gaps
Okay.
are at the joint line. Glide occurs between the radius and ulna. Gap is
Okay.
here.
Okay.
Gap is here at the joint line.
We're making space.
Glide is here.
Okay.
Okay, let's do the next one.
Thank you.
Okay, you're welcome.
You're welcome.
So that one, medial glide. There we go. Yeah, there we go. So it's gonna be, the movement is gonna be here between the radius and ulna. Okay? Medial glide, where am I gonna place my hands?
On the radius.
On the outside. Okay? And my stabilization goes up here. So it's different, right? So gap is here, glide is here. I'm gonna put him in open pack or loose pack. And I'm gonna stabilize here. I'm gonna glide toward the ulna. Also increasing flexion and extension. Okay? So the glide is here, right here, the lower part here. Okay, stabilization is above. You okay? Grade 1, 2. Okay, how I remember where gap and glide is? GAP has 3 letters. Okay, it's at most proximal, the joint line. GAP, gap, right here, put a GAP. Glide is lower, has more letters. Okay, so GAP fits right at the joint line. That's how I remember them. Okay, yeah,
What?
it helps you retain it.
Can you repeat that again?
Yeah, for sure. So gap occurs at the joint line. you're affecting the spool,
Uh-huh.
while glide is lower, and you're affecting the radius and ulna. Okay, lower.
But when you do glide, you still pull your hands in, right?
Okay, so gap is here. Glide is here.
Right.
The slide and glide is here. In glide. The gap, the slide is here. They're both indicated for increasing flexion and extension. Okay, very nice. We just did that one already. Next. Okay, let's move on to the humeral radial so that we can. And now this one we're back to Freddie's rules. This one follows Freddie's rule. Okay, what type of joint is this? So it's an anomaly. Humeral radial. Who remembers this one?
Modified ball and socket.
It's atypical. It's missing the head. Missing the head of the radius. Concave and convex. Okay. Again, let's take a look at the loose pack resting position and all that. So again, one more. So the closed pack is opposite to humeral ulnar. Okay, one more. So, actually, you have to go all the way. The other way, yeah. Back to humeral radial. That's okay. Just go to the theory. Yeah, keep on going other way. We'll end there,
Okay.
and we'll go to the humeral radial theory, so they can have it on the board. Yeah.
Radio.
Yeah. Sorry, it's just rolled up. One more. And one more. Keep on, couple more. Sorry. To the theory portion of humeral radial. Okay, and just one more. There we go. And one more. Okay, here we go. Humeral radial. Okay, so atypical synovial ball and socket. Remember that one? It's missing the head.
Bilateral.
Okay, concave and convex. So this one, the closed pack position
Concave and
is 90 degrees of flexion. So I'm gonna make sure when I do a joint mold, I'm not gonna have it in this position. Okay, loose pack is the opposite. Full extension supination. So they're opposing. All right. I did make a silly thing in my head to remember resting position.
Let's hear it.
And so I live in a neighborhood where a lot of people ask for a change. So they're in this position, right? They're in
Right.
this loose pack position for the humeral ulnar joint.
I see.
So so I made a thing. Panhandling is ubiquitous in my neighborhood. Ubiquitous meaning humeral ulnar. So that's the resting position for the H2 joint.
I feel like we might think of something else.
So think of things that have,
Yeah.
have meaning to you. So that's how I remembered it.
Right.
Okay? And they just want to be acknowledged in my neighborhood. So I always say, I don't have any change. Sorry. So they just want to be acknowledged. Right. Okay. So let's go back to the mold so we can practice it all. So we're gonna go to humeral radial. Okay, so the first one is HR distraction. So this one is just stabilizing here, and we know that this is closed pack, so I'm gonna have him neutral. Push down on the table a little bit, stabilize, and just pull. Okay, remember we're affecting this side now. Nice easy one. HR distraction. Let's go to the next one. Posterior glide. So it's concave and convex. Kaltenborn says same. So if I'm gonna do a posterior glide, so I'm gonna find that humeral radial, find that joint line. Okay, here's the radius, pronate, supinate. You can feel the head. I'm gonna stabilize at the joint line, and I'm gonna do a posterior glide of the radius. Okay? Okay, and remember this is loose pack, this is resting, so it's okay. Posterior glide, same, increases what? What movement does it increase? So same.
Posterior glide.
Yeah, so I'm going backwards. Extension, you got it. So to increase extension is the posterior glide. Same. Okay, I'm gonna do, I think the one on the right is the preferred one. The one on the left is not very good. What's that circle say there? Stabilized humerus?
Oh, stabilized.
Yeah.
Is it patella?
I thought it said
Mhm.
allies.
Alright, so I like the one on the right. So I know close pack is 90 degrees, so I'll put him down. Okay, and put him down to about 70. And I'm going to stabilize here. And I'm gonna go up or anterior that way. So it's this way. Okay, radial head. Okay, what's that gonna increase? Yeah, you got it, same thing.
Flexion?
You get the idea now, right? Humeral radial
Increases what?
flexion, anterior glide.
Flexion.
Yeah, because flexion is anterior.
Yes.
The bone rolls anterior. This is the last one.
Right.
Pivot joint. Okay, so dorsal volar, because I want you guys to have at least half hour to do this. Let's go to the glides. So PRU anterior glide. So this one's a tricky one. So this one showed up on PBAs, by the way. So I want to spend some time on this. So proximal radial ulnar joint. We studied this in arthro. I'm going to review it for you. Okay, to palpate it, we find the joint line, find the head of the radius. Okay, pronate, supinate. I can feel the head of the radius right here. It's the synovial pivot joint, diarthrotic. Okay, so when we look at the articular surfaces, the head of the radius is convex. Correct?
Correct.
The head.
Mhm.
Okay? The notch is concave
On
Do
the
you
ulna.
on the ulna. Correct. Do you remember the name of the notch? It's opposite. Come hither.
Radial.
The radial
Notch.
notch.
Radial notch on the ulna. You got it. So it's convex on concave. Okay? So it's going to be opposite. Sorry. All right. So it's going to be an anterior glide. Is it anterior? Yeah, PRU. So it's going. So we're gonna pincer grip the head of the radius, and this is going to be an anterior glide. Okay, to help with supination. When I look at supination, it's away from the midline. Okay, the bone rolls away from the midline. In joint moves, that is defined as posterior. Okay, it's really obvious when you take it out here. Here's neutral, supination forward, anterior, pronation backwards. So I'll do it again here. Neutral, supination goes away from the midline. Pronate, yeah, posterior. Supination goes toward the midline. Anterior. So an anterior glide of the PRU increases what?
Pronation.
Opposite. Yeah, pronation. Okay, and then this is the next one.
It would be, isn't it supination?
Sorry, supination. Yeah, sorry.
Yeah.
Yeah, anterior. Sorry,
I said it.
supination.
No.
Yeah, sorry about that. Yeah, let's do the next one. Sorry, I'm just ahead of you guys here. Posterior glide helps with pronation.
Posterior
Yeah.
glide helps with.
Pronation. So let's look at the roll first. Pronation
Anterior glide.
goes forward toward the midline. The
Yeah.
bone rolls forward.
So anterior glide helps with that.
Yeah. No, it's
No,
gonna be opposite.
opposite.
It's opposite.
Oh my goodness.
That's opposite.
Sorry, guys.
That's okay. So let's do it again. Let's do it again. Sorry.
Okay.
Okay, let's do it
So
again.
much mental gymnastics.
Okay. Okay, so the roll of the bone is defined if it's facing the midline or away from the midline.
Uh-huh.
So whatever is facing the midline is anterior.
Yes.
All right? Anterior, midline. All right? So pronation is going to go toward the midline. You see it?
Mhm.
The roll is going to the midline, anterior.
Going
Pronation.
towards the midline.
You can see it here.
Got
If
it.
if I take it away from anatomical and I do pronation, you see it's going forward.
Mhm.
Pronation. When I go neutral,
And because
It's
you're
going in.
convex on concave,
It's opposite. yeah.
So.
So to increase pronation, which is anterior, see that? That's going toward midline. I'm going to do a posterior glide.
What is period?
To increase supination, it's going backwards. I'm going to do anterior glide. I think that's it. Hats off to me. Hey, let's do it. I want you to get as much practice as possible. We're gonna do it slide by slide.
I think it's proximal radial ulnar.
Slide by slide.
Yeah.
Yeah.
Good guy, yes.